everyone. So as you know, I'm Georgina Chambers. Today I'm going to be talking to you about falls in the older adult and the importance of trying to prevent them and educating the older adult on how signs and symptoms regarding it. So first things first, put my glasses on. Don't want to fall. So falls, as we all know, is not a normal part of aging. Rather, it's considered a geriatric syndrome. So everyone's like, oh, I'm old, I'm just gonna fall. No, like that's not okay, you shouldn't do that. And falls occur everywhere, even in the hospital. So it's imperative that even as healthcare workers that we're watching our clients and making sure that they aren't falling. As fractures are the second most serious health consequence related to falls, especially hip fractures. For those that had mobility before, 50% actually don't regain their mobility back. So it's crucial that we try to prevent it, and even we all have family members or parents that are getting older and weaker. And so we need to do due diligence on educating them as well and making sure that they're okay. So risk factors for falls obviously is age, cognitive impairment, frailty, pain, and sleep meds, especially sleep meds because it makes them drowsy. Impaired mobility and balance. Balance is crucial to not falling, obviously, but if we do have issues with balance, we need to use assistive devices such as these walking aids, canes, and walkers. I'll talk about these later. And risk factors we also need to assess for include vision, poor muscle strength, gait and balance, pain, memory, and orthostatic hypertension. We don't want our patients or our family members sitting up and then bam, on the floor. So it's crucial that we assess for these. Also, for every patient in the hospital, we always know that we do the Morse fall scale. If you're interested in looking at it in the book, it's table 12-3. I recommend you know it front and back. So walking aids. We have canes, 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 and more canes. As you can see, they all vary. Some have just one foot, some have, it's a tripod, or you have a 4 quad pod. Is that right? I don't know, but that's what we're gonna call it. And then you have your wheelchairs, the actual walker, the scooter that I want one day, and then you have this cool little seat that you can collapse it and it'll act as a cane by just using this one, or you can take it shopping with you. So when you're tired, because we all love shopping, you can just sit on this and voila, save yourself for later. So talking about the canes, you have your standard just everyday medical cane, and then you have these for like elbow support, crutches, and then going on to walkers, here's a better picture. We have these cool ones. So there's two typical main walkers that people use. There's these ones that you use like around the house, getting up from your bed to the bathroom and stuff like that. Or you can use this one to go grocery shopping, and it just helps increase your mobility and your independence as an older adult. And for those of you that aren't crippled yet but are interested in not becoming crippled, this is what you want to get your parents. My mom, for instance, she has a rare muscle disorder. So our whole house within the past 3 months has been walker-proofed, fall-proofed, and assistant device-proofed. So we have walkers in every room pretty much. We have side rails in every bathroom. We have removed all rugs. But within this process, I've learned how crucial it is to evaluate your assisted devices. So, I mean, you can't just grab a walker and start walking with it. Especially these ones. So for proper techniques to use it, you want to walk close to the walkers. So this one, you want to make sure that they're the right height, because you can see they're measurable and adjustable to everyone's size, as well as these. So you want to make sure that it's properly fitted to the individual. Proper ways to fit it include, I think, standing by it. Yeah. So you want to stand next to it, and your wrist should hang right here. And if your wrist is lower or higher, you need to adjust it. And if you experience wrist pain, then it needs to be resized as well. You also need to not use this walker to just stand up. So if you're sitting in a chair and you're like, oh, I'm going to go for a walk, don't use the walker for your support. Use the armchairs or some other sturdy device to help yourself up, because this is going to plop over. Also, you've seen a lot of older people put tennis balls right here, and you just want to make sure that it's not, you want to replace the tennis balls every so often because it can get smooth, and you do want some friction here because this is their only stopper. So a lot of people put the tennis balls because it makes it easier to drag along while they're walking, but you just need to assess it every now and then to make sure it's working right. And these walkers also come in different sizes as well, and different, I guess, wheel types. So they have like 1 wheel or 2 wheels, 3 wheels, and the 4 wheel. Okay. So I printed out this cool little pamphlet that I found online, and it talks about preventing falls step by step. So for every room, you want to assess the quality and the safety of the room. So for instance, if you have a 2-story house, you want to make sure you're using the railing to go up and down, proper lighting on the stairwell or by your bed. If you are living in home, you want to have a low bed as close to the floor as possible, so you're not gonna like fall off the bed trying to get up or get in it. That's my grandma, like, no. She always tries to like hop up there and then like roll over, but it's like, if you would just lower the bed or use the step stool we had, problem solved. But it's my grandma, she's 98 years old, what are you gonna do? Anyways, so you also want to have a low bed. Get higher toilets. We've replaced all toilets in our house. My dad wasn't happy, but whatever, you have to do what you have to do. So higher toilets just make it easier for the individual to get on and off the toilet, along with grab bars. But the higher the toilet, the easier it is for them to get off. You want to put non-slip rubber mats in every bathtub, as well as right outside of the bathtub. Monitor medications, like I said, pain meds and sleep meds. Use hearing aids because you need to be able to hear what's going on, not get startled. And use your glasses. You know, these are miracles. I never wear them in class because fashion statement, but I need them. That's why I don't say hi a lot of times, because I can't see you. But anyways, also for shoes, when you're walking around the house, you want to make sure that you have sturdy shoes, non-slip soles, or if you're wearing socks, make sure they have slip grips on them. You also want to put, if you live where it snows, like Colorado and stuff during the winter, they have cool little cleat adaptations that you can put on your shoes, little spikes, so that you don't slip on the ice. So yeah, here's a cool little picture. So bathroom safety, bedroom safety, remove clutter, use railings, clean spills as soon as it happens. Don't be like, oh, I'll get to it, because you don't know if your mom's going to be walking in the kitchen and she doesn't see it and then boom. I haven't done that, but I'm scared. Anyways, so if something does happen and you're home alone or you live alone or you know someone that lives alone, you've all seen this. Help, I've fallen and I can't get up. Well, that's called Life Alert, Lifesaver. My grandma has 2 different ones, and it's saved her numerous times. Just for if you can't be there, you have to go run an errand, and you can't reach the phone. It's like a little necklace that you wear, and so if you do fall, you can press the button, and it calls an ambulance for you, or they have some that it's like a little mini cell phone with a speaker, and so you can just speak into it and tell them, you know, I'm okay, but I do need help, or if no one answers, I'll send an ambulance anyways. But fall safety is crucial. Like, don't be falling. Also, risk factors for falls include sedatives and hypnotics, environmental hazards, footwear, like I already said. Recent hospitalizations tend to increase the risk for falling as well. If you use a wheelchair or reckless wheelchair use, come on, be a safe driver. Get a designated wheelchair driver, then, you know, increase your risk. But, or if you have a balance disorder, like I already said, dementia, poor vision, polypharmacy, so if you're using multiple meds or using multiple doctors for multiple diseases, then you want to make sure you have someone cross-reference those meds to make sure they're compatible or you're not overdosing yourself. like I said, home environment, cardiac issues such as orthostatic hypertension and low heart rate might require pacemakers and footwear. But I hope you guys learned a lot for this video. I know I did. I had fun. I hope you had fun. So stay tuned for more fall safety. Bye, guys.